Hey everybody, this video, it's all about what it's like after having your colon removed and recovering from ileostomy surgery. I've been wanting to make it for a while, but I just haven't really had a chance to put everything together. So I have here a couple of the questions people have asked me, or kind of like topics, I guess more specifically, um, formed in the questions. And I'll do my best to answer, just generally speaking, but more so, just my own experience, what my recovery was like. So let's go ahead and see what some of the questions were. Waking up from surgery, for me, I woke up a little bit early. They told me I woke up around about an hour earlier than they expected, and I remember being very, very groggy. I don't really even remember seeing a lot of this. I was all kind of hazy, but I can remember my parents being there, and I could hear the doctors telling them to come back because I wasn't really fully awake. So, um, probably maybe 2 hours after that or so, I think they expect like maybe I don't remember exactly how long after the surgery, but I want to say in my case, like the first things I really remember were about, I want to say maybe like 4 to 5 hours after surgery. And I was alert, I mean, still a little groggy, and just feeling kind of, I think the all the sedatives still kind of hadn't worn off yet because I remember still just feeling kind of numb, stiff, and it just felt good to be still. And anytime I would move, I mean, of course, my midsection really hurt because it's just so freshly cut up. But yeah, I remember, I was in my room, I was settled, my surgeon was there, my parents were there, and it's just kind of letting you recover. I think about 7 or 8 hours later, they took me on my first walk around the just around that floor of the hospital, and the hardest part was just the probably for the first 2 to 3 days was just getting out of bed and back in bed because just everything hurt at your midsection. I mean, in my opinion, not any more than you would expect it to, considering the procedure. But it's just one of those things. There's not really any way around it. It just it hurt. Your body didn't didn't want to move, um, and yeah, that was pretty much it. The rest of that first night, you're just kind of in bed, getting settled, and beginning the recovery. There's not really a whole lot to it at that point. Just kind of you want to lay there and let everything settle. I seen my stoma for the first time. That's kind of funny because I know for some people, depending on how your surgery went, like meaning if it was emergency surgery or maybe the doctors recommended it, and when you go to the hospital that that's what you're gonna have the surgery, so it's not like a total emergency, but it's not 100% your call. You might be kind of just trusting the doctor, but you're not really haven't really had time to look it over or research it much. It could be a little more shocking. In my case, as you know, it was more my choice of when to do it, and it just it was time, so I felt like I was ready, and yeah, I didn't think it was going to be too shocking. However, at the same time, I kept thinking I don't really want to look at it yet. I want to. It wasn't so much the stomach, but I think just my stomach in general. Knowing that it was all cut up and there's going to be scars and stitches and everything, and swollen. I guess just in the whole area I didn't want to look at, but. I think it was the second day, one of the times when the nurses came to check the output or something, and they have you, lift your gown and kind of drop the blanket. I accidentally looked down, like not really prepared and not ready to. Um, and actually, the first thing I saw that was even worse than the stoma was seeing the urinary catheter. And I kind of looked down and was just like, looked away really quick and then saw the stoma too. And it was a little shocking because again you had the scar and everything just didn't look it didn't look how it did last time you saw it, obviously. But I just kind of saw it as just this big red dot, and it's kind of like, okay, yeah, that's what they look like, and this is mine. So it's kind of like that scene. It's also the well-known meme with the Jim Carrey from the Ace Ventura movies. With the two spears, one in each leg. He's kind of like anywhere I looked down there, just I didn't want to see it. But it wasn't too shocking for me. I guess maybe if just doing your research, if you just see, that's one thing online. And a lot of people have said just sharing theirs. It's not that big of a deal. I mean, it's just like a lot of body parts, like maybe like your nose, your ears, or your hands, whatever it are. Like they all look a little different, but they generally look the same, and you'll get used to it. It's not wasn't that shocking for me. In fact, that those early days in the hospital, like many of you, I've named mine as well. If you don't follow me on Instagram and didn't know, I call my stoma Jupiter, and it got that name because just how round and bloated my belly was with this big red dot that early on it's also very swollen and bright red. That's what it reminded me of, was the planet Jupiter with the big red dot on it. So that's how it had its name. After that, not just seeing it for the first time, with those first few days, because it definitely is bigger to start with, and that's one thing they told me too, is like it'll shrink down a little bit because when you attach the bag, you have to cut well, over time you can get them pre-cut, I believe, but a lot of them will come and you'll actually have to cut the little ring to fit yours. And from early on, it will shrink. And even depending on other things, it can, like I've noticed when, like if I eat something that kind of irritates it or whatever, sometimes it'll swell back up a little bit, and you can tell it, like very, very small changes, but it can change size and shape a little bit sometimes. Um, but yeah, early on, it's just this big fat red dot because it just I mean you've just been operated on, so it takes a while for that to kind of settle into place as well. First eating, overall, this is kind of a complicated question for me to all get into, but in general, I think for most people, just within the first like 48 hours, you're able to start adding real food. I think most doctors and surgeons will have a little bit different guidelines. Like I know mine, for example, you started on solid food, but I know the consistency had to be something that could be mashed. So like soft fruit, hot cereal, like yogurt, kind of things that are very soft. Or like a banana, for example, it's something that can, like they said, without much effort, you can kind of smash it down into mush. So those were the kind of foods I could eat first. I don't remember exactly how early they tried to give me some of those, but in my case, I actually I had some complications. It's kind of a long story, but in short, I ended up being in the hospital for about well, actually exactly 2 weeks. I was discharged from the day of my actual surgery, but in most cases, you get to go home within about 3 to 5 days is what's expected. That's before they knew that was going to happen. That's what my schedule was. Most people that I know of that have had it done, it's just a couple of days, and they start you off with those foods, and I think they'll pretty much discharge you once your stoma is working. Once what you eat is coming back out as well. And in my case, it was like I said, about 2 weeks because um, just to kind of cut right to it, my as I just said from the last question, it naturally just kind of swells up. Well, I guess mine had swollen up so much on the inside that things weren't passing through, and it took them a while. They just had to kind of let me sit and observe. They weren't sure exactly why it wasn't working. They told me it's not that uncommon for sometimes it just take a while to wake up the bowels is the terms they would always use, and that's one of the reasons they get you walking is walking kind of gets the whole digestion just blood circulating and kind of gets that going. But yeah, I'd been walking and it wasn't working. So I couldn't figure it out, but ultimately that's what they decided. And for maybe 2 or 3 days, they had me taking some diuretics, and eventually the swelling went down, things started passing through, and I was able to go home on a restricted diet. And then again, I'm sure every doctor has slightly different guidelines, but mine they just give you like every maybe 2 weeks to a month, you can start adding like sort of like a new type of food to it. And the last one in my case was like I think like raw nuts and raw vegetables were like probably the hardest thing to digest, which you would add later. But as long as everything is working, they just kind of let you use that guide as a kind of as a map to start, and then you just kind of use your best judgment of when you can add those things. And they just really drilled it into my head. Just you have to make sure you chew and chew and chew. And what my surgeon had told me is what she finds in most cases is not so much that there's a specific kind of food that people can or can't eat. A lot of times, when you've had surgery and you recover and you get back into your normal life, you get back into your normal routine. You're probably really busy, and people just don't take the time to think about chewing their food. And you eat too quickly, especially eat the wrong thing too quickly. It's going to cause problems. So that's what she said. Is in most cases, it's somebody ate too quickly rather than you can't eat something. Although of course there are some foods that are harder, that I consciously have to be a little bit more aware of. What can't I eat? Really, I have not come across anything that I just flat out cannot eat. That being said, I'm paranoid of corn, just because that's probably the most common one that I've heard that a lot of people can't eat. Um, I never really ate a lot, and I mean actual corn kernels, not like corn-based things. I don't really eat a lot of corn anyway, so I don't really miss it. But I just have this paranoia that over time, I've experimented with so many foods, and I can eat like just such large amounts and do such crazy things with eating. I just think it'd be so ironic that like a little corn kernel is what's going to send me to the ER someday. So I just kind of have this paranoia of corn. However, I know of a lot of people who can eat it safely, and they've told me if I can eat things like peas, beans, lentils without problems, which I can. They said corn's probably fine, but like I said, I'm not in any rush to do it. Um, for whatever reason. But things that do give me trouble consistently, um, certain lentils and quinoa. Like I eat a lot of like this mixed grain and rice combination sometimes, and it's not so much that I can't eat them or they have trouble going through, but on the way out, they create just like a very thick output, and it'll actually like seep under the seal. And sometimes, like as it's coming out, it just kind of pushes the seal off, which is obviously not not what you want the output to do, especially overnight if you're not awake to feel it pushing off. Because if you're awake, you can probably feel it when it kind of bursts or seeps under. And if it's bad enough, you can change it immediately or just be aware of it that you need to address it. But if you're asleep, it might just push right off, and that's very bad. But so some of those grains, they can give me a little bit of trouble as far as the thickness. Um, just in general, raw vegetables are harder, obviously, to digest than cooked vegetables. So when I eat raw vegetables, I'm just always, cautious to chew them very thoroughly. But I would say, for some reason, green peppers have had a history of kind of going through a little bit harder. Again, not so much that I can't eat them, but um, they might upset my stomach a little bit. And then certain foods too, or even just vegetables in general, if I, maybe have just not intending to, but didn't chew them thoroughly enough. When it comes out, you can feel sometimes like there's a false sensation of your stoma like being active, but then like when you check your bag, nothing's actually come out, but it feels like it's coming out. Or other times when it is coming out, it's a little bit like, I don't want to say painful because it's not, doesn't really hurt, but I mean there's just, it kind of has like a pinch. You can kind of feel it straining, and it just it's hard to explain, but if you have one, you'd know what I mean. But it just, you can tell that it's straining coming out. And I've had other vegetables like carrots and asparagus do that as well. But again, it's not so much that I can't eat those things. I'll typically avoid those ones that give me trouble just because it's not worth it. And I don't really miss them. Like, I'm not that upset about missing asparagus. And green peppers, the red, orange, and yellow are much easier for me to digest. So typically green I'll only eat if it's on pizza and it's maybe a pizza challenge or something. But other than that, there's really nothing that I found that I flat out cannot eat. Which going into surgery, I did not know that. I was thinking most people still have, some limitations, but that's not the case. And just one other thing I wanted to touch upon, just on this topic, is on some of those the guidelines that they give you, so I take things very literally. So if it says like maybe one of the first things you can eat is just low fiber foods, but then one of the examples would be like refried beans or oats. I'd be like, okay, well those beans and oats, those have a lot of fiber, so can I eat those or can I not? It doesn't make sense. But what some of the surgeon staff told me, and this makes sense too, is like when you see those contradictions, usually like just the safe bet is, and this sounds kind of gross, but they say if the food going in, whether it's high fiber or low fiber, or regardless of the fiber content, if the food going in is pretty much the same kind of consistency that it's going to be coming out, it's probably safe to eat. So refried beans, for example, as far as appearance, go through, like it looks almost exactly the same and smells almost exactly the same on the way out than it did on the way in, which is makes you look at refried beans differently. I know it's gross. Oatmeal, again, depending on what you put in it, it's probably going to look just the same, but it's a little bit darker on the way out. So that's what they said. If you're not sure about a food, if it seems to kind of like overlap and contradict one of the guidelines, that's what he said is a pretty good bet. He's just, if it's the texture and consistency is about the same going in as it is coming out, he said it's probably safe. So I went by that. Never had any problems with them. So that's just one thing I wanted to mention as well before I moved on to the next part. The worst part of the recovery, immediate recovery in the hospital, by far, unfortunately, I had to have one of the nasal tubes. And, I still don't know for sure what caused the problem. It might have just been a natural reaction, as I mentioned on one of the earlier questions, that just in response to the surgery itself, my intestines had just swollen so large that they swelled shut and things weren't passing through. But I also had a definite reaction to the powerful pain medications, Dilaudid, I think it was called. And I think I only took 3, maybe 4 doses. They have it hooked up to your regular IV, and it's a little green illuminated button, and you can only press it like once every 2 or 3 hours or something like that, just because it's very powerful and they don't want you taking too much. And then when the light comes back on, it's safe to take again. But I really didn't want to take any strong meds, but obviously I was in pain, and they talked me into it that it was probably safe. And every time that I took it, within about 1 to 2 hours, I would get really dizzy and just feel really hot, and ultimately kind of have these dry heaves that they were no good because again, nothing was passing through all the way. But also just having to contract, that really hurt my midsection. Whether I actually spit up some of the liquid or just had those hard coughs, that was really uncomfortable and painful. And over time, because I had drank too much water, my stomach got really distended, and they had to bring in the nose tube to drain it all out. And that thing is the worst. I've told anyone going into surgery, that's asked about this experience, it would just anything with make it clear to your nurses and the staff that just anything to avoid that tube. Believe me, it is the absolute worst. From other people that I've spoken to, it seems like they only get it set up really late in the middle of the night, in these awkward hours. And I was thinking it's just it's like a pump or a drain. Okay, so it lasts a couple hours, or it'll be out by morning. And no, it usually takes a few days. And mine, I think it took about 3 days. I think it was from I want to say from a Thursday night to a Sunday, something like that. But or maybe a late Wednesday night to a Sunday afternoon, or I don't remember. But it's bad. It's really uncomfortable. Them putting in place, and even when it's in place, and they tape it in place too, so it doesn't move as much. But I mean, typically any way you move your head, or even talking, just that little bit of movement of the facial muscles, you can feel it. And I mean, obviously being in the hospital anyway, you're not going to get a good night's sleep, but it's the kind of thing where you're so tired, you have no choice when you're going to fall asleep one way or another. But anytime you relax enough that your head moves, it wakes you up, because it's so uncomfortable. And it's even talking at the volume, I guess, for lack of a better term, that I am now, it hurt to even move like that. So you had to keep very still, and I felt like I could barely talk even because even just talking, made it hurt, and it would almost sometimes you'd have like a gag reflex a little bit, and you start coughing, and oh my god, yeah, it was really bad. I remember very well when it came out because that was one of the best times. I remember my parents were visiting at the time. It was a Sunday afternoon because football season, football games were on, and when it comes out, I mean, you can almost still feel it. Like it feels like it's still there. But and it's gross too because I mean you could see all the stuff coming out of it, like just in the peripheral vision, and yeah, there's nothing good about it. So I would just recommend to anybody out there, ask someone who's had it, what their experience was like, and just I don't care how much you're pain or anything you're in. I promise you that tube is worse. it's I feel comfortable saying that for sure. And yeah, that was the worst part for me, definitely. I would say just to be optimistic. I mean, there's no guarantee that the surgery is going to be like a complete success. In my case, it's way better than I ever imagined it would have been. So that's obviously good for me. But depending on as I said, your maybe what your health was like, what kind of shape you were in, before the surgery, that will kind of vary on when how quickly you're able to recover, and also whether you have Crohn's or you have colitis. Obviously, that is going to change too. Like there's still might you might still have some restrictions, but ultimately, I don't know anybody who just flat out says, "I wish I didn't have surgery." Like even people that have had some, in some cases, it's like they had a bad surgeon and maybe even had some problems, but overall they still feel like they're better off than they were beforehand. And anyone else too whose surgery was a success, like it might not be perfect. You might not have like your full life back, every little aspect of it. But I don't know anyone who wishes they didn't have surgery. So I would say just to get yourself in the mindset of just it's going to be a new experience, and just definitely new challenges. There's some growing pains. Like I would say like that first month or so, it can still be very inconsistent as you're healing. Like generally, like what they say is like whatever volume amount of food you eat, within several hours you'll notice that you'll probably have about the same volume come out as output. But early on it can be very inconsistent, it can be gassy, it can still be kind of uncomfortable. I know for me it took a long time, and part of this is just because also your activity level is not there yet, but it took me a long time for me to get my full appetite back. And I noticed, even as I was able to expand my diet, like just really small amounts of food kept me very, very full. So, it takes a while for everything to settle down, but I would say just expect a lot of problems and kind of inconsistencies, and some of the hardest parts that first month or so, in the hospital, and then even when you get home, it's it can be a little inconsistent. There's probably going to be some accidents, some problems, but those are all just things to get used to, and just like most things, you'll adapt, and you just kind of make note of that, and change it. And I remember when I had the doctors I didn't like so much, one of the specialists I would go to, which he was actually a really nice guy, but we just had completely different views of how I wanted to be treated. But like I said, super nice though. And I remember one time he told me, and this is when they urged me for surgery, like back in 2011. And I remember he told me it's not that big of a deal, and like that really pissed me off because I'm like, it's not that big of a deal, like it's a huge deal. And I remember telling him, if it's not that big of a deal, why don't you have the surgery done just to kind of show your patients that it's not that big of a deal? And he kind of laughed. He's like, well, of course I wouldn't do that, which to me I just took as like, well, obviously that's total BS then, or else he would get it done. But yeah, after having it done, I can see where I can see what he meant, that it's not that big of a deal in the long run. However, at the same time, like I think like most of us, like we don't want to hear that kind of stuff from people who don't have the disease themselves, even though someone like him obviously knows a lot of people that do. But yeah, ultimately, I would just say to think of it in the big picture, like don't think of these little things early on when you're not used to it and it's not fully healed. Don't think that's how it's going to be forever. And if you keep that mindset, I would say in the long run, it really isn't that big of a deal. I've heard other people say that they forget it's even there. You won't even notice it, which I wouldn't go that far. Like, it's there, but it does almost just become like another body part. In many ways, people have said too, and I can relate more to that because you do know it's there and you are aware of it, but over time it does become less of an issue, or less of something you're actually conscious of. Like you'll just do things and not really have to think about it or worry about it. But like I said, I would just do some research, reach out to more people. If any of these questions, I tried to answer them as concise as possible. Like most things, they all kind of come with more of a story. So you can leave a comment or send me a message, or if you follow me on Instagram, you can reach out to me, and I can elaborate on any of them, even more. But hopefully you found that helpful. It just that that's my experience with just the initial recovery, like primarily still in the hospital. I want to make another video of just kind of what that first month or so is like back at home, in particular when to be active again, because that can also vary a lot from person to person, and even the medical staff too, like their guidelines I know can vary quite a bit. So that is another video I'd like to do. So maybe if you like this one, or send me some comments, that'll motivate me to get going on that some more too, especially while we're doing the stay-at-home order. I have nothing better to do. So hopefully I can answer more of your questions. If people reach out to me and give me some feedback. So until next time, probably next time you see me eating, stay hungry and be healthy.